I'm Mary. I'm back. We're going to talk about levels of autism and kind of the diagnosis and how that works, what we do with that, all that jazz. So, you look in the DSM-5, the current one right now, and autism is now one diagnosis, autism spectrum disorder, and is split into 3 levels. Level 1, Level 2, Level 3, based on functioning or levels of impact. This is the language that you'll hear professionals use, or should hear professionals using, to describe someone's diagnosis as needed. So, to put this in perspective, someone with my abilities is level 1 autism. So I have certain struggles with social skills and some with sensitivity and sensory needs, but beyond that, my autism does not generally impact my daily life beyond that. Some of our people with level 3 autism are those that are going to use assistive communication devices for all their communication, maybe have severe sensory needs that have high and daily impact on their life. So, just kind of an overview of what I'm talking about when I say those things. More commonly in the non-autism community, just out in public, you'll hear a lot of references to high-functioning or low-functioning autism. As someone on the spectrum, or in any way associated with the spectrum, even professionals, these terms are not appropriate at all. I have yet to meet a single person on the autism spectrum that prefers that terminology. It doesn't help anyone. Someone like me would be considered high functioning. I've used the term to help people understand what I mean when I describe what I go through, but it makes me super uncomfortable. Whenever I say that I am high functioning, people assume I don't have needs. High functioning doesn't mean I'm perfect. It doesn't mean I'm neurotypical. It doesn't mean I don't have needs. It just means that my needs are considered less by everyone else. Someone, on the other hand, who is considered low functioning, someone with more severe verbal needs, someone with less ability to communicate on their own and communicate their needs independently, is gonna be considered severely disabled and, in most cases, intellectually impaired, when in so many cases that's not what's going on. IQ tests require so much verbal language, but any other types of tests of intellect would show you how smart and how much there is inside of our brains, no matter what level or how high functioning or low functioning we are. Unfortunately, with those types of terminology that were commonly used, even now are fairly commonly used, it always hurts the individual, whether you're high functioning and not getting the help you need because everyone thinks you don't need help, or you're low functioning and you're only getting help and you're not getting any support in your independence. No one's letting you do your things and move towards your needs, or really listening to what you need. Really just kind of taking their own thoughts as to what it is that you might need, which makes absolutely no sense. So obviously, as someone who practices as an RBT, likes to talk in front of people, I tend to use levels when I'm describing autism, just to stay on the professional side of things and make sure that I'm in the least offensive place possible. Though if someone asks me, my personal preference is to use level of impaction. So I am someone who is not impacted highly on a daily basis by my autism. So I will say I am less impacted by my autism than some people. Whereas someone who maybe needs support, significant support in daily life, someone who maybe is level 2 or 3 autism, might say they are more highly impacted by their autism. I find that to be a good way to communicate the need for support without downgrading any personal strength or intellect. So that's kind of my compromise between everything. But really the best way to kind of keep yourself sane in all of this is ask the people you're talking to. And when you can't, if you're talking to a large crowd, my suggestion is always go with what is considered professional, as usually that gets you in the least amount of trouble. But until next time, I will see you soon.